My name is David Cadogan. I'm an emergency medicine physician here at Alaska Regional Hospital and the Chief Medical Officer. So if someone's trying to decide, is this something I need to go to the emergency department for versus an urgent care, there are a few things that may help guide them. If it's something where you would normally see your primary care physician but are unable to get in, that's probably more appropriate for an urgent care. An example would be getting a prescription filled after hours. If you run out of medications, that would certainly be more appropriate for an urgent care. Things like minor ankle sprains, sore throats, minor cold or flu symptoms are certainly appropriate for an urgent care. When you're talking about emergency department, typically we're looking at more serious or severe diseases or injuries. So someone who's experiencing chest pain or significant trouble breathing, new onset of abdominal pain or uncontrolled vomiting would be appropriate for an emergency department. Most fractures or joint dislocations, you would want to go to an emergency department for that. Also, some minor lacerations can be handled at an urgent care or a primary care clinic, but for deeper or more complex lacerations, certainly an emergency department would be more appropriate. As far as injuries are concerned, head injuries are more appropriately managed or evaluated at an emergency department where we can get the imaging performed in a timely fashion. Other things where you would typically want to come to an emergency department would be bleeding, vaginal bleeding in early pregnancy, where typically you would need some further workup more than would likely be done at an urgent care. We're a certified stroke center. We also have a chest pain program. We are the only hospital in Alaska that has a neurointervention lab. So the classic signs and symptoms of a stroke typically would be a sudden onset of weakness or numbness, typically on one side of the body. Sometimes that can be associated with speech difficulty. Sometimes it's difficulty concentrating or understanding. It can manifest itself as difficulty speaking, being able to form words or find words that they would normally be able to easily say. It can be associated with a sudden onset of headache with new neurologic symptoms as well. So strokes can present in a variety of manners, but the most common would be weakness or numbness, mostly on one side of the body. So the classical symptoms of a heart attack would be chest pain, typically on the left side. Most of the time it's described as a tightness or a pressure within the chest. Sometimes that will radiate or move to the left arm and commonly will be associated with trouble breathing or nausea. Less commonly, it can present with just nausea or just shortness of breath, especially if those symptoms are made worse with exertion. Other times it can be more unusual or what's called atypical, where it's just unusual or unexplained fatigue or weakness. If you or someone you know are experiencing signs that are concerning for a heart attack, the right thing to do is call 911. The reason that's important instead of driving yourself to the hospital is that with the ambulance, they can get the treatment started right away. They can also alert the hospital to what's going on so that by the time you get there, we're already prepared and have things ready to go.